Good morning, everybody. Today we have Stephanie with us and my teacher, my mentor,
Sir.
Dr. Rutledge, back to India, back to Kular Hospital.
Of course.
And now we have Stephanie. She is our beloved patient. She is a great human being. She had a band and then band was removed and now we have done MGB on her. So about your experience, about Dr. Rutledge's experience, we need to discuss certain issues of band and MGB, and this is just for education of our patients so that we can, share our knowledge and enlighten the new patients so that we can take better decisions in future. So what do you want to say, Stephanie? What's your experience about your surgery? This is the third surgery which you got done. First of all, you got the band and then band out and then MGB. So how do you feel about India, Punjab, this hospital and everything? Just give me a brief story.
Well, about the hospital, I think it's great, amazing staff. Everyone is nice, everyone wants to help. And the rooms are quite comfortable, so yes, the hospital is great. Post-surgery care has been amazing. Pre-surgery, amazing. I think pretty much everything was fine. I wasn't scared. I didn't even know when I went to sleep, and I was up and it was done. So, about the surgery, great. MBG, I can't say much yet because it's just 3 days out. But I've seen results from people, I've seen videos, and I hope I'll be a great success story. About the band, not such a great success story. I had the band almost 6 years now, 2011, and I think I lost weight only the first month. Obviously I was on 10 days liquid diet, and obviously I did lose weight, and maybe a few weeks after, but then after a while I think everything just pretty much settled in, and I found a way to cheat, so I just ate, and when I threw up I ate again, and yeah.
And can I say that's not cheating? Can we talk about that a little bit?
Okay, yeah, sure.
Yeah.
So I don't know, it just didn't work for me, and I've watched a lot of videos online that show that it didn't work for a lot of other people as well. So there's definitely something wrong. And the worst part of it is I took it out last year, and I was told that I had a lot of indentations around the stomach. So, the band squeezes tight and it leaves a lot of scars and stuff. And this is almost 8 months after, and I still have a bit of scars. So having an antibody inside of you and taking it out and having scars, not a great idea. So, that. Okay.
So Stephanie, what made you take this decision? As we know, your mother is a radiologist and your father is he's a surgeon. He's a pediatric surgeon. So is it your medical parents who told you to take this decision, or is it your own independent research on MGB? So how did it happen?
80% constant nagging from them.
Okay.
Mama, do you hear what she says of you?
Yes.
Mama says I should give you a pinch.
Because I think everyone really should try and be happy in whatever skin you find yourself until it becomes a serious medical condition. Luckily for me, I don't seem to have any associated illnesses with obesity, so I don't have high blood pressure, I don't have any sugar problems, I don't have diabetes, nothing. And I'm actually very up and doing, so I don't feel like I'm losing out on anything in life. But because they're medical doctors, there's a constant reminder about your health. It's going to get worse if you don't watch it now. And then everyone keeps saying, you're going to be prettier if you were slimmer. You're going to be, if you were like that. So,
Okay, but forgive me, can I interrupt? I think if I could stand up for your parents for a second, I'm smoking cigarettes. They don't bother me. Why do my parents tell me to stop smoking cigarettes? I'm fine with cigarettes. Obesity is somewhat the same, I would think, as smoking cigarettes or drinking too many alcoholic drinks. Obesity doesn't harm you at all, as you were saying now. You have no harm, if I heard you right, you have zero harm from obesity for you right now. No harm. But I think your parents know, we know the science of smoking. We know that 40 years from now, you might have lung cancer, chronic obstructive bronchitis, emphysema, lung cancer. Okay? Obesity is very similar, in my way of thinking, to smoking cigarettes. If today you are well, your parents are happy, and you are happy. But we also know that obesity carries a risk. It helps us predict your future. Now, we don't know for sure. You might be able to smoke cigarettes and drink alcohol and live to be 90 and have a good life. But in many cases, obesity wears down the body. It develops these things you talked about: diabetes, heart disease, stroke, and people then, as they suffer those things later, it's hard to get their life back. Once you've developed lung cancer, it's hard to say, oh, I quit smoking now. So what I think your parents may be thinking, and Mama is shaking her head yes, she loves you and she knows what the data shows. The hard data shows, as wonderful as your life is now, we have the potential to give you maybe a longer, healthier life with a 30 to 40 minute surgery.
Yeah, sometimes even I think that all the common diseases are somehow directly or indirectly related to obesity. You talk about any common disease like type 2 diabetes,
Yeah,
hypertension, heart attack, stroke, sleep apnea, joint problems. I mean, these are the common problems.
Especially the common problems now. I mean, in India, Africa, the diseases that killed were a different kind of diseases. Now that we have prosperity, now that your family is physicians and you are an attorney, this is a whole new world. Now you have the risk of American diet. And with this diet, we know the future. That is, obesity leads to all the things Dr. Kular was mentioning. You face the risk of diabetes, heart attack, stroke, osteoarthritis, and maybe we could prevent that with a 30-minute surgery.
Any other thing?
No, not now.
Still, if you have any questions in future, just be in touch and never forget us, okay?
Please reply my emails.
Yeah, every month you should be writing us email about
I
your
did before
update.
I came. I sent you an email, but I didn't get a reply. Yeah.
And but you're right though, that is good. Kular is superb in his patient contacts, and you've gotten, I think, one of the best surgeons in the world to do your operation, so you can be very pleased.
Yay.